to yet another show of Youth Diaries. Now, the youth of today would have a lot of questions regarding infertility in the future. We have with us Dr. Jayeeta Samanta, who is an IVF specialist and is currently working as a consultant and unit in charge of reproductive medicine at Kinder Women's Hospital and Fertility Center at Cheratthala. Welcome to the show, doctor.
Hello, and thanks.
Doctor, according to the patients that you get, what is the most common reason for infertility?
The most common reason is found either in the male partner or in the female partner. Previously, female factors used to be more, but nowadays, as we see, male factors are competing equally with female ones, and in a very small percentage of cases, there can be a problem with both of them. So that has to be ascertained in a very systematic fashion as to where lies the problem.
Doctor, we'll move on to the first question.
Sure.
Hi doctor, I'm Leah. I was a student of Chemotherapy Engineering College. I want to ask you a question that my sister has been married for the last 1.5 years and she has been trying for pregnant to get the last 1 year, and whether she have to consider an infertility specialist for a pregnancy.
Okay. Usually in 1 year, 84 out of 100 couples would be getting pregnant. And if you look at 2 years, 92 out of 100 should be getting pregnant. So if after 1 year of trying your sister is not getting pregnant, it is better that she goes and consults a gynecologist and gets some basic areas like investigated, like a basic semen analysis of her husband, a look at whether she is ovulating, which can be looked at by a simple blood test, and an ultrasound scan of her pelvis to find any gross abnormality. If everything looks normal, then of course she can wait for another year or so, provided she has a healthy lifestyle, she doesn't have any other health problems. And then if she is not conceiving even after 2 years with no other problems noticed in the basic investigations, then it is preferable that she goes directly to an infertility specialist.
So the basic time is like 1 year you try if you don't get?
Yes, the basic time is 1 year. After that, but if your age is more, you can start investigating yourself even after 6 months. If she is young and doesn't have any other apparent problems, she can wait for a year.
All right. Thank you, doctor. Now the second question.
I'm Sumaya Babu from Chemotherapy Engineering College. I've got a doubt. My friend is obviously with irregular periods. She's planning to get married next soon. Okay. Does she have any problem in getting married? I mean, getting pregnant?
Okay. Irregular periods is a very common problem with the young girls of today that can be ascertained to our diet, our lifestyle, and of course environmental factors. The most common reason for a young girl getting irregular periods is a condition which is called polycystic ovarian syndrome, where the girl does not get regular ovulation every month. So it is not necessary that she will have problems in conceiving in future, but in case if she finds that she is not conceiving within a period of 1 year, then she should go and meet a doctor. Because in polycystic ovary syndrome, they can also ovulate infrequently. Only in the cases that they are not ovulating at all do they need to go and see a doctor.
Now, what all can be done to control the irregularity?
The first and foremost thing that needs to be done is to lose weight. As she said, sister is obese. So whatever be your chances of getting pregnant spontaneously will get reduced if the weight is more. So what we look at is the body mass index, which is a ratio of the weight in kg by the height in meters square. So this BMI or body mass index should be within a range of 19 to 25. If you are underweight or if you are overweight, there may be a problem with your ovulation, and that can lead to infertility. So first and foremost is losing weight, and then after getting married, if she is not getting pregnant within a certain period of time, she should go and meet a doctor to get some simple drugs to get her ovulation corrected. And then if these drugs are not working, then she can step up the treatment step by step. There are medical methods, surgical methods, and even go till the higher level fertility treatments like IVF if required.
Thank you, doctor. For the next question.
I've got severe pain during my periods and I consulted a gynecologist. She said I have a chocolate cyst in my ovary. So will there be any problem for me in the future, especially having children?
Okay. Disease called endometriosis, where we find the inner lining of the womb, that is the uterus, growing in certain places outside the uterus. In her case, as she said, this endometriotic tissue of the inner lining of the womb has been growing inside her ovary. So that can lead to severe pain during periods, because all these endometriotic tissue inside your abdomen would be growing again at the time of your periods, and that can cause severe pain. But the only aspect that we are worried about as an infertility specialist is that this blood may be irritating all the surrounding structures like her uterus, the tubes, the ovaries, and her bowels and everything, and that can lead to all these structures sticking to each other, something that we call as adhesions. So if there are pelvic adhesions, then there is a chance that she will have problems in conceiving in future, definitely. Because in endometriosis we see that 30 to 50% of women with endometriosis would be having problems in conceiving.
Okay, this is about a chocolate cyst. Are there different types of cysts?
There are various types of cysts. This particular chocolate cyst is what we find in endometriosis. A chocolate cyst does not necessarily mean that she will definitely have infertility, but yes, she has a higher chance, because endometriotic deposits may also be there in other areas of the ovary which are not being seen on the scan. To find those areas, she needs a surgery called a laparoscopy. But those things needs to be done once she is married and she has tried for some time, and in case if she is not conceiving, she should go and see a doctor and get these things investigated.
Are the other cysts also as dangerous as this one?
No, of course not. There are a lot of different types of cysts which are found in the ovary, some which can be benign, some which can be cancerous. Of course, in a young woman we don't think of cancer at the outset, but out of these benign cysts, if it's small cysts like polycystic ovary syndrome, those are not so dangerous, except of course fertility issues, weight problems and ovulation problems, but they can be treated with simple drugs. But simple cysts, otherwise hormonal cysts, can be found if the cycles are having some hormonal problems in between, which can also be corrected by drugs. Chocolate cysts are the one which may be needing surgery. Apart from this, we also have different types of ovarian tumors like dermoids or benign tumors which can also present as cysts. So if such cysts are persisting over a period of time, then they may be removed surgically.
Doctor, next question.
I'm Chandishri from KME Engineering College. My sister had a chemotherapy for lymphoma. Is there any chance to her having a child? What are the precautions to take?
Chemotherapy for lymphoma or for any other cancers can lead to destruction of the cells within the ovary or in the testis in case of a male person. But then whether your sister would be having this problem depends on what drug she has used, what dosage she had, and of course her age. In a very few percentage of cases, the fertility may be again returning after a period of maybe 6 months to 1 year. But in case if it is not, then she might have to go for other routes of reproduction.
Okay, what would be the reason for this to happen?
These drugs are highly toxic to any cells which are rapidly dividing in the body, and the two areas where cells are rapidly dividing at any time is the ovary and the testis. The cells which we call as germ cells, these cells are very easily affected by chemotherapy, radiotherapy, or even stem cell or any transplantation, bone marrow transplantation type of treatments which are used for different types of cancer.
So after taking these drugs, it's advisable to have a test?
Yes, of course, but then it is of course advisable to have certain tests even before you are planning such a treatment. If your oncologist has been advising you to undergo any cancer therapy, then you should discuss your fertility issues with the doctor before going ahead with the treatment, because the treatment can't be compromised, because that has got an impact on the life. Life has to be prolonged, so treatment can't be compromised. At the same time, we should also look at how to save her future chances of reproduction. So nowadays there are options of egg freezing for females and sperm banking for males. So egg freezing can be done before a woman undergoes this chemotherapy or radiotherapy, where her eggs can be preserved and she can use these eggs in future when she wants a child.
So doctor, when it comes to obese women or girls, what are the, suppose they already are in the proper BMI, would every obese girl have a problem of irregular periods?
No, not necessarily, but then if you're obese, if you're having a family history of your parents having diabetes or heart disease, or your mother has had a history of irregular periods and she also had a child later in her life, then there are chances that you also would be having polycystic ovarian syndrome. Of course, we can't treat it very aggressively in the unmarried period. It is a problem of ovulation and infertility that she might be facing later on. But at this stage, before marriage, the girl should definitely go for a lifestyle modification, dieting, exercise, taking healthy foods, avoiding caffeine, alcohol, rich restaurant foods, like, you know, nowadays all the girls are going into mall hopping and restaurant foods. You should really avoid and try to go for a healthy lifestyle so that your weight comes down, your body circulation increases, and that itself would lead to spontaneous ovulation and pregnancy in many of them.
Is this also a hereditary problem?
Sometimes, yes. Polycystic ovarian syndrome nowadays has been linked to many other bigger diseases which comes later in life, like diabetes mellitus, heart disease, hypertension, that is high blood pressure, and which can lead to several other complications like brain, stroke, and all those things. All these things nowadays is being told to be as part of a single metabolic syndrome that we call, which has a basic problem with the insulin in our body. Insulin is a hormone which is being secreted by an organ called the pancreas, which is there in the mid tummy. And that hormone is supposed to regulate all the metabolic factors in our body, the majority of them. And if there is a disturbance in insulin metabolism, it can lead to a variety of diseases. So now all these diseases are together called as syndrome X. The first glimpse of which we get at an early age when there is a young obese girl who comes with irregular periods, excessive hair growth, excessive pimples, acne, and we label them as polycystic ovarian syndrome.
Okay, so the best way is to have a proper diet and exercise.
Yes, lose weight, proper diet, proper exercise, and there are no magic bullets to reduce your weight.
Okay, so hard work you have
Yes,
to
of course, that is the healthier way to do it.
Thank you. Now moving on to the next question.
My name is Nihala. I am studying in KMA College. My question is that my friend is 20 years old, but she never had periods yet. Doctor told that she doesn't have a functioning ovaries, but her uterus is normal. I want to know whether she can be having a kid.
Yes, this condition is what we call as primary amenorrhea. If a girl is not getting periods by 16 years of age, then she has to be looked into, and it can be due to several causes. Either the ovaries are present, the uterus is absent, or the uterus is present and the ovaries are not functioning, like in this case, or if both are absent or non-functional. It is a difficult situation, I can understand, and if her tests and scan shows that her ovaries are really not functioning, then her chances of getting pregnant or having her own child is dim. It's really low. But nowadays with the modern therapy like IVF and what we call as test tube treatment, there are ways out where if a girl does not have eggs of her own, then she can use eggs of a different young healthy woman and use them to fertilize them with her husband's sperm and then use that embryo in her own uterus, which was found to be functional and normal, and give birth to a baby. But though these types of treatments of course has to be done very ethically as per the rules and regulations of our government.
Now if the uterus is not functional but the ovaries are, then is there any other way other than donating it?
If the ovaries are functional and there is no uterus, then she can have her own genetic baby provided she uses the uterus of another woman. That is also called a treatment called gestational surrogacy.
Okay, are there any other problems that could occur? Because, as in the girl we heard, her problem, is there any other health issues that could happen?
If this problem is part of any generalized syndrome, usually this non-functioning in ovaries are associated with some chromosomal problems. Chromosome is something that we get from our parents which contains our genes. Chromosomes are structures which are present in every cell of our body. So these chromosomal problems usually have a long list of other problems associated, of which one may be this non-functioning ovaries. So the most common chromosomal functioning which is associated with this non-functioning ovaries is called Turner syndrome. So it has to be ascertained whether this girl or this young woman is a patient of Turner syndrome, and in that case her heart, her skeleton and other aspects has to be seen and looked into. She can have problems, but mostly such problems are not very serious, and we have had lot of Turner syndrome patients who do get treatment using a donor egg and they have given birth to babies.
And is that, does that affect the health a lot, giving a donor or conceiving from another woman?
No health problems as such, but then there are certain aspects of the treatment which has to be looked into if you are taking an egg from a different source. The compatibility, her own uterus, because if the ovaries are not functioning and the uterus is normal, then the uterus would be a small sized uterus, because as you said, she never had her periods. If she never had her periods till the age of 20, the size of the uterus would be less than what a normal uterus is. So initially her uterus has to be made ready so that it's able to receive the embryo, and then the embryo should implant in it. Only then she will get pregnant, and then usually she is able to carry forward the pregnancy provided there are no other systemic problems like heart and all those things, and she can give birth to a baby.
Now doctor, we have an email with us. This is from a 21-year-old girl. I had an ovarian removed last year by an operation because of a sudden abdominal pain. Will it affect my future chances of getting pregnant?
Usually this typical condition would have happened if she had a sudden torsion of one of the ovaries, and then the ovary gets what we call rotten or gangrenous, and then it has to be removed. But in case if her other ovary is normal and her tube on that side is patent, then she can get pregnant very well. But in case she is not getting pregnant, that is the usual dictum. If you are trying and you are not getting pregnant within a period of 6 months to 1 year, then again it has to be seen whether the other ovary is normal, tube is normal, and of course she has to keep her threshold lower of going to a doctor, having only one ovary. But then of course with one functioning ovary, the ovulation continues in that ovary, and every girl has got equal chances of getting pregnant.
So it's not a it's not a disease or whatever that you have to be very scared about?
No, not really, because her ovary, one ovary which is still there would be continuing to ovulate, and if she is having a patent tube and no other problems within her pelvis, then she might as well get pregnant. But with a history of surgery and a history of one ovary being removed, if she is not getting pregnant within a period of 6 months to 1 year, then it is better to go for further evaluation to a doctor.
Now doctor, for the youth of today, what kind of remedies or lifestyle changes would you recommend in order to prevent further infertility?
Okay. The youth of today is having a very different lifestyle, diet, their expectations as well as their future plans, which was very different from the generation which we had in the past. So of course our current youth is much more energetic, they are much more broad-minded, and that has got its bad effects also on aspects of health. As far as infertility is concerned, it is always advisable to have a watch on your weight, especially for young females, and a watch on your lifestyle. It is very essential that you don't go too much out on smoking, alcohol, caffeine consumption and strenuous physical activity. Physical activity within a certain limit helps to increase your body circulation, keeps the metabolism and all other activities in normal limits, but then too much or too less of it is bad.
Thank you so much, doctor, for taking your time to come here. It was very informative and you explained extremely clearly. Thank you so much.
Thank you.
That was Jayeeta Samanta, who gave a really clear explanation to all the problems. If you have any further inquiries, you can mail us at youthdiaryrosebowl@gmail.com. See you all next time. Bye-bye.